My name is Nafisa Wara. I'm a first year medical student in the global health pathway at the University of California, Los Angeles, Geffen School of Medicine. And today I have the absolute pleasure of interviewing Dr. Cynthia Gonzalez, who is the director of the Community Partnered Policy and Action stream at the Pardee Graduate School. Thanks so much for joining us today, Cynthia.
Thank you, Nafisa, for having me. Looking forward to talk to you all.
Yeah. But as we start, just to orient our viewers, would you mind telling us a little bit more about yourself?
Yeah, this question oftentimes takes me all the way back to when I was a kid. So it's like, where do you start? A little bit about myself. So yes, I do lead the Community Partnered Policy and Action stream at the Pardee Graduate School. I'm also an assistant professor at Charles Drew University, where I started off in high school. I benefited from a high school research program and have been there ever since, and went through sort of the academic pipeline while building my interest in community engagement and addressing health disparities and arriving at ways in which achieving health equity. With that, I'm a daughter and product of Watts, so I cannot introduce myself without mentioning that, a lot of my lived experiences have informed my professional journey. I am a daughter of Mexican immigrants, first generation Chicana, and very proud of the communities and the legacies and the leaders that have opened up the doors and opportunities for me to sit here and talk to you all. And lastly, of the many hats, I'm also a leader for the Robert Wood Johnson Foundation's Culture of Health program. There, it's a national program of incredible thought leaders doing equity-minded work. And so I've had a series of experiences that have allowed me to arrive at this very prestigious program. And so with that, a lot of what I do is participatory research, where we ensure that community is at the table, at the decision-making table, in addressing the most pressing and complex social issues that they're facing. Yeah. Hello.
Yeah. No, I mean, I think it's so telling just how so much of your past has influenced, the work that you do and what you find really valuable and important to contribute to right now. And that's always something I've found really inspiring. It seems like your passion for health equity started really early on and was a part of so many of those different hats that you were wearing. So, do you remember when you first knew that health equity work would play an important role in your career?
It's really funny. I'm a storyteller by nature, so I'll share. Um, my mom tells a lot of stories about me growing up, sort of trying to support folks who were marginalized, or friends who were mistreated, or um, trying to organize. She tells a story of like how in preschool, like instead of me going to play at the yard in the mornings, I'd go inside and set up um, the classroom so that we would all be ready to, go into class. And I'd line up my classmates and I do things like that, so there's little stories of how there's this sort of passion that one inherits that we don't understand. Um, Equity studies has been around for quite some time, but I didn't have the language to talk about sort of the organizing work I did in K through 12, or what we did in undergrad through social movements and programs for youth. And then what ended up becoming a career trajectory. There wasn't a term for it, but considering, and I mentioned lived experience a lot, considering reflections on how we were brought up, growing up in a neighborhood where, I had to tell my friends, don't park on this side of the street, park on this side because their car could get broken into, or sundown, we couldn't play anymore outside, or, violence was, you could really taste it. And leaving for higher ed and realizing that not everyone lived in the ways in which you did really was a call to why, to asking why, right? And that's when I started finding the terminology. Oh, some folks were assigned opportunity over others. No time like the present, and talking about this in February during Black History Month, where we read about it and we learn about it, but to really taste it and see it, and have a term for it is really important. So I think it's, a lot of the leaders here in the community mentioned this, like, it's not something that you arrive at, it's something that's sort of inherent in you. And it being looking for achieving equity, right? And when we place the term health right before it, I think it's everything, right? Our well-being, achieving human rights and basic human dignity. And I think that's an inherited piece. You don't arrive at a point in time. I think there's milestones and moments like being able to work for our local city government, or doing a research project on health disparities, or starting your own student organization at a young age to address inequities and identity, right? Race, class, gender, sexuality, and such. So I can't really pinpoint. I can just say that at the face of injustice, there was a need to really address the differences by group type, wherever we were. Yeah.
Yeah. It's I think it's really evident how it is that intrinsic thing as opposed to something that you come across later on in life. And I guess connecting that back to, you've spoken a little bit about growing up in Watts and how much that has influenced, you know, how your viewpoint on life, as well as, I think, like, this intrinsic, you know, equity, a passion for equity. How did you get involved with the work that's being done with the Watts Rising Collective?
Another story. When I was completing or finishing up my PhD, I knew I wanted to do something in Watts. I knew that my applied work and my dissertation would be sharing a story and a narrative about my community, but I couldn't come in assuming I knew my neighborhood because I was born and raised in it, right? So we designed, in partnership actually with our local city government and a series of leaders that came to the table, we designed the Watts Community Studio. It's like a neighborhood assessment where really, I came in this really like eager and ambitious, student researcher wanting to do this 2-hour interview with 200 residents on this 12-page survey that I developed. And community quickly, taught me that applied research looks drastically different. We ended up interviewing about 1,000 Watts residents in a sort of 15-minute self-administered 3-page survey that was co-designed with community leaders. And little did we know that we were designing this beautiful program where we brought on board high schoolers from Watts to learn about community-based participatory research in their neighborhood. They administered the surveys and learned about CBPR. And then our leaders and our cohort of stakeholders in Watts co-designed our survey. And we asked for permission to be able to do this. We asked folks, should we do this project? Is it necessary and whatnot? And the Watts Community Studio was born. This was about 7 years ago. And we, designed a report and sort of had this data-driven recommendations that we developed with our youth. With that, fast forward maybe 5 years later, there was an opportunity that came across for our community known as the Strategic Growth Council's Transformative Climate Communities Grant. It was a $33.25 million grant to do neighborhood improvements through like a greening of the neighborhood. And it had to be data informed and data driven. And so having been connected to leadership, to government, to folks through the studio, we were brought on board as a data partner to see if the work developed by Watts Rising would actually reach its residents through the Watts Community Studio model. And that's how I was brought into Watts Rising. We actually helped co-design the grant. We did these beautiful traveling workshops where we had our stakeholders and our residents map out where they wanted to invest, what kind of projects they wanted to do, and again, participatory in nature. It was a really exciting grant. It is a very exciting grant, largely because it's community driven, community informed, but also it has a displacement avoidance plan. So as much as we're beautifying our neighborhood, we're making sure that it's for the people that currently live here, all willing. I was able to lead the grant once we got funded for about a year and a half, 2 years. And in that role, I learned more about sort of the day-to-day management of such a large grant. And then we were also able to secure an additional 35 million for our neighborhood investment work through HUD. This is federal dollars for our local redevelopment of a public housing site. So yeah, we continue to be the data partner and hoping to have our third version of the Watts Community Studio in the summer this year. Yeah.
That's amazing.
Yeah.
It's so much success for a project that I think really just defines participatory efforts. And I just think it's so cool, especially just how so much of it was initially youth led too.
Yeah, at least for the studio, was definitely youth led. For the What's Rising sort of collaborative piece, it was just having folks at the table who would historically not be at the table together, right? Really sort of becoming a unified front locally, and then facing a global pandemic that impacted us locally on sort of immense ways, largely because we depend a lot on in-person. That's what participatory engagement is. That's what community engagement is. And so now we have to think differently, not innovatively, because even in-person engagement activities are innovative, but just a different approach. And so that's sort of some of the lessons that we're trying to learn and implement as we think differently about what engagement looks like during this pandemic.
Yeah, no, I mean, it's amazing. And I'm glad that, amidst the pandemic, it's able to adjust and continue the important effect that it's able to have for Watts. Pivoting a little bit, a lot of folks who I think are committed to health equity maybe are interested in balancing how they engage with their local communities as well as how to engage globally with global communities. And I know that you've done graduate work in global health equity in the global health equity space, in addition to your work, that's locally based in Los Angeles with Watts, as well as with these other institutions that you're working with. So, how have you navigated finding this balance between the local and the global for yourself?
Yeah, as a daughter of Mexican immigrants, the global has always been in my space. We traveled to Mexico often when I was younger, and the ways in which I saw or witnessed poverty or identity or social conditions were very different. As an adult now, interpreting them is also very different. I did do a practicum in an applied learning project while in grad school, and that's actually what sort of pivoted me to think about the local. We did an assessment in Panama, and then the sort of neighborhoods that we visited, or the impoverished neighborhoods in Panama that we visited, looked very familiar to home. So I wanted to come back and commit to a local perspective and participatory efforts at the local sort of region, but really informed by global understandings, right? So I'm definitely not in sort of a global health expertise or knowledge that I can provide in terms of doing work globally, but I do feel that the ways in which I balance doing my locally based work is that we learn from international perspectives as well. We take into account international models. I mean, I think the Cuban health literacy model, right, really shifted health outcomes in Cuba. And so how do we bring health literacy into Watts locally, right? So there's these different sort of approaches at the global arena that could definitely inform the ways in which we do work locally. And I think that's how I balance it. And folks doing work globally could also think what's working locally, right? And that's sort of how this bi-directional approach to learning from each other is really important.
Yeah, synergy and kind of exactly what you said, a learning from each other.
Yeah,
Is really valuable. So a lot of students who are and trainees who are interested in maybe in either global health spheres and or health equity spheres may want to get involved with supporting community-based organizations based in LA. Based on your experiences, both as a resident and as someone who's involved in this health equity sphere, especially, what next steps do you suggest for trainees, especially if they want to support a community that they're not directly a part of?
Whoa, okay, that's an entire like full on like conceptual sort of framework discussion, right? On how does participatory engagement work, right? First, become very familiar with the community and the population that you're trying to work with, right? Cultural humility is a practice, right? So understanding your own positionality, your own identity, being in reflection about who you are and why you want to be in these communities is really important, and as much as you learn about the communities, understand that we can't generalize, or we can't say, oh, because this data said this about a particular community or population, I already know who they are, because community is really good about teaching you a little bit more about them. And so at least centering yourself in some historical understanding, in some understanding of your own positionality. We don't always understand our biases, but being reflective of those that do come up is sort of the prepping piece. And then show up in your most authentic self. I know for me, the community leader that I will respect eternally, took me 2 years to work with him. And I was a Watts resident. And he gave me a 20-minute meeting because we were connected through a mutual friend. And he said, I'm only meeting with you because you know this person. You're a researcher, and researchers that come to Watts and take in information and never come back, which is what traditional research has done, right? And recognizing those violences on our community as well through knowledge production. But once engaging with community, I was very authentic and said, I don't assume to know what's going on in my neighborhood, and that's why I need you. And I don't assume to know that because I was raised here, I know better. I want to learn from my neighbors. Yeah. He said that was sort of insightful and felt very genuine, and that led us to build a relationship and assisting me in learning more about Watts. And so being very authentic, right, and being in constant reflection. Don't be afraid to reach out to community, right? Challenge those sort of either imposter syndrome or like insider outsider perspectives. Like if you're already having those perspectives, it's because you're thinking critically and reflecting about your own positionality. And so move forward in speaking to the agencies, right? Look up who the ED is, or who are the key players that you want to talk to, and request meetings. If you're connected in some way or another, find that as well. And be honest, right? It's also that a lot of trainees may not be in the communities that they're working with or volunteering with forever. And so being honest and transparent about building that trust and sharing, hey, I can offer this. These are my skill sets. Is it useful to you? Insofar as, I also understand that I'm looking forward to learn from you in these areas, because again, it's bi-directional. Is really the approach. Just go full steam once you've sort of done the prep work, and understand and share a timeline, right? Don't make empty promises that won't be able to be kept. I think it's important. Yeah.
I feel like I should have just been writing down all of those steps. That was like really, I think, really, really valuable feedback. Thank you.
Thank
and
you.
Valuable advice for any student or trainee who's interested, I think, in pursuing this kind of work.
Yeah.
And how can students at DGSOM or faculty or alumni engage further with the work that's going on at Watts Rising?
Yeah, visit our website for sure to you could become a little more, again, become familiar with the project. What is the collaborative? What do we do? There's over 20 projects attempting to implement during a global pandemic, looking at planting 4,000 trees in a concrete jungle neighborhood, as it is known. And so there's monthly public forums that folks can become familiar on what the work is, what work is being done, what opportunities there are. But I think for additional engagement, feel free to reach out to our team. You can either get on the listserv on the website, reach out to me, or reach out to the leadership at the Housing Authority. You could also find their contact information on the website. But I think there's, from health education seminars that community is thirsty for, on a virtual platform, to tree planting events. There's actually one coming up. There's a sort of an event happening at Matown Farms on Saturday, February 19th. Visit us on social media and you'll get more information there. But there's those opportunities as they come up for sort of urban gardening and farming and such. There's yoga sessions at Matown Farms as well. There's out of the Watts Community Studio and the work that we're doing that in that space, we're actually going to be conducting interviews and doing surveys in the community. So if you're welcome and interested in doing that, please reach out to me. And we have to go through the whole research process and training, but we'll be doing that during summer, both virtually and in person as it's made possible. Become more familiar with us and again, like I mentioned, just dive in, reach out, and I think it depends on the student and alignment, so that we figure that out, sort of where the best alignment is. We have displacement avoidance policies, we have housing policies on sort of our local public housing development as we're figuring it out. We are looking at public health and environmental health and how to improve quality of life of residents in these buckets, and really beginning to think about what activities we can do. We have a walking club. Because of Omicron, we had to pause it, but it's coming back as the numbers are coming down. But on Friday mornings, community gets together and they walk to the Watts Towers, facilitating that. So the list goes on. I think it's just reaching out and putting yourself out there to see where we can align here.
Absolutely. Well,
Yeah.
thank you so much for just this entire interview, for telling us so much about yourself and about the work that you've engaged with throughout your career, as well as the incredible work that Watts Rising is doing. And I'm so excited to, find ways that I can get engaged, and I'm so excited to hear about ways that other folks in our community are going to be able to engage as well with such an important project. Thank you so
Most
much for
definitely.
joining
Thank
us
you.
today.
Thank you. It's so great to see you. And thank you for the time and space. I appreciate y'all.